Finishing treatment and getting the all clear is a major milestone for people with cancer. However, despite thinking that they should feel relieved or happy after treatment, many people don't. Often, people have fears that cancer will return. This could be an occasional fleeting thought through to more serious fear and anxiety that happens every day. Every ache, pain, or wait for scan results can trigger concerns about cancer coming back. This is known as fear of cancer recurrence. If not addressed, these worries can lead to isolation, anxiety, and difficulty planning for the future. But there's a way forward. Alongside almost 100 health professionals and researchers, an Australian team has created a step-by-step plan for health professionals to identify and support those experiencing fear of cancer recurrence. This clinical pathway has 3 steps. Step 1 is screening. People often hesitate to raise concerns about cancer recurrence. Asking a single question can help identify those experiencing these fears. Step 2 is assessment. Discussions with their healthcare team can determine the severity of a person's concerns and guide the best course of action. Step 3 is stepped care. A staged approach to providing tailored support ensures every person gets the help that's right for them, whether it's additional information, validation from their healthcare team, support from others affected by cancer, or treatment by a mental health specialist. No person affected by cancer should fall through the cracks or feel alone in their concerns about recurrence. By following this clinical pathway, every health professional can help people affected by cancer to thrive, not just survive.